I'm Michael Lanuti. I'm one of the thoracic surgeons at Massachusetts General Hospital in Boston, Massachusetts. I'm in a rather large division of thoracic surgeons, and I'm the director of thoracic oncology for our division. I have clinical interest in lung cancer, esophageal cancer, mesothelioma, and I also have a translational lab that looks at novel treatments of lung cancer. The length of hospitalization after lung surgery is dependent on a couple of things, including the patient's preoperative condition, the complexity of the surgery, and the overall absence of postoperative complications. For lung-sparing surgery that we mentioned, which includes wedge resection, patients can expect to stay in the hospital one night, sometimes two, particularly at elderly patients, where they can arrive home and be functional, and it would take about 2 weeks to recover. And that's assuming that that wedge resection is done with a minimally invasive technique, either through small incisions on a camera or robotically. An open incision for a wedge resection would require being in the hospital 3 or 4 nights with a longer recovery of about 4 weeks. On limited occasions, patients can be discharged the same day after a limited wedge resection that's uncomplicated in a young patient. If the operation requires removal of more lung, like a segmentectomy or lobectomy, but can be achieved with a minimally invasive technique, the patient can expect to stay in the hospital 2 or 3 nights, and it would take about 4 weeks for a full recovery. In the setting of the traditional open incision, termed thoracotomy, for lung cancer surgery or removal of an entire lung, or even something called a sleeve resection, the patient can expect to stay in the hospital 5 to 7 days with a recovery time of about 6 weeks. Any surgery that's more complex than I mentioned, or perhaps that may have complications, as might be pneumonia, arrhythmia, or even bleeding, will require longer stays.